hips, the legs, the inner thighs, or what have you. So the floor is yours. Cool Sculpting at Colonial Aesthetics, right there where the old black tie was, off of Westmark Road. Tell us what happens. Tell us about this, and tell us how we can get rid of this fad.
All right. Cool Sculpting is by far one of the neatest procedures that I have run across. I started looking at this procedure about 4 years ago, and it caught my eye because as a woman, I have always not liked my stomach. And I could have been the fittest of fittest, and then it could have been right after having children. I never liked it. So this caught my eye because I thought, I've always dealt with heat, like with the laser and things like that, but I thought cooling. So I started to look into it more, and everything that I saw, I absolutely loved. Right from the very start, you see their brochures, and they say, eliminate stubborn fat. I thought, I got that. So then I looked into it a little bit more, and Cool Sculpting without any surgery, no needles, no downtime. You literally can lay for an hour and remove 20 to 25% of fat in one area.
How wide's the area? Does that depend? I mean, so let's take, maybe if we can, let's take a body part. Let's take the love handles. Okay. Let's take a handle.
Yes.
One side of can we get both handles done at the same time? Do we do them at one time? What are we looking at?
You do it individually.
Okay.
You will hook one side up, and that love handle will sit there in the applicator frozen for an hour. As that love handle is frozen for an hour, the fat cells within it are now depleted. They're no longer viable, and it is as simple as the body flushing those dead fat cells out of the body. The kicker is it happens over a 3 to 4 month period.
Okay.
People want things yesterday. That is not going to happen with Cool Sculpting. And that's one of the things I like, because it is a gradual process, and you start to see the results within those first 4 to 8 weeks, but truly it continues to work even at 3 and 4 months later.
Let me back you up a touch. What do I feel when I'm sitting there and you say I hook you up and it's cold? Is there discomfort? Am I freezing? Am I...
There is a little discomfort with it. I tell all of my clients in their consultations, this is like a major surgery without surgery. I'm not telling you it's a walk in the park, but you literally lay, and there is an applicator which feels like a very, very strong suction, like a vacuum cleaner.
Okay.
And it pulls the excess volume into it, and it has 2 panels on either side of the volume, and those panels freeze the fat cells that are sucked up in between them.
Okay. So
you feel a pinch and a tug and a pull right at the beginning, but after about 6 to 8 minutes, it's numb.
Okay.
When I first thought about it, I thought all I could remember was if I had a sprained ankle or wrist in high school, you had to put your hand or your foot in the bucket, and I thought, I cannot sit there for an hour like that. Well, it is nothing like that. After the first 6 to 8 minutes, you're relaxed. We have a TV. You can watch Netflix. You can listen to music. You can work on your iPad, whatever you want to do.
Gotcha.
And we try to make it as comfortable as possible.
Okay, now we've come in. We've isolated the area. We have gotten through the first procedure. We understand it's a 3 to 4 month, which is, hey, let me tell you, anybody who's taking a crash diet and they've lost 20 pounds in a week, I promise you they will put 40 back on in 2 weeks. So we're looking for long-term effects. Does this give us that? Is there maintenance involved after it? What do we have?
Yes, it does give you long-term. And I want to say something real quick. You just mentioned weight loss. Cool Sculpting is not a weight loss. It's not a diet, and it's not an exercise. I am literally just treating that excess volume.
Right.
So it is very important that you still exercise. You still want to eat right. You still want to be healthy, because Cool Sculpting is not doing that for you. It is truly just treating that area.
It sounds like all of us, and I'll be honest, but where my area, I rarely get heavy in my stomach, but the sides, for me to get narrow in those love handles, I have to be almost emaciated. And and I think we all that are listening out there, and you'll probably echo this, we go and we work hard, whether we're trying to build size or try to slim down. And the areas that we slim down in are not the ones we want to, and it really doesn't have an effect on what it sounds like Cool Sculpting could bring.
That's because it's stubborn fat.
Exactly.
It is stubborn volume that most of the time you can work it, and it's still going to be there.
So we can go to the stomach. Let's talk about guys that might want a six-pack look, who have done the 100 sit-ups and do all that, but also can't forego the beer on the weekends.
You just got to get hooked up.
You just get hooked up.
You just got to come get hooked up.
Get hooked up with
and
Cool
just
Sculpting.
see, huh?
Yes. It's,
I know what I'm getting Mara for
crazy.
Christmas now.
It's crazy
After the
because
massage,
I tell people I literally laid for 4 hours over a 5-month period last year, and started it in January, and by July it looked like I had a 6-pack.
So you're
that I
saying
have
very
never
little
had.
exercise, and I know you take care of yourself, but so you're recommending
changed
diet
nothing.
and exercise, but what you had been doing hadn't achieved the results that you've wanted. This then was that extra over the top. You still were disciplined to the extent you were
Exactly.
prior, but then you had the looks that you'd always desired.
One of my favorite quotes from a client just last week. She came in February. She came back for her follow-up pictures, which I do a 60-day assessment with all my clients. And she looked at her before and afters, and she said, well, I would have never done that exercising. I mean, it was just,
That's profound.
that difference.
So let's talk about, we can come in and we can isolate an area. We talked about that, and that takes the procedure as an outpatient. You back at work, you a little discomfort for 6 minutes, maybe takes an hour to do. Now let's say I want to hit the other area, whether it's how often can I come back if I'm not going to that specific area? Can we hit on another area the next day?
It's truly up to the client. I have some people who come in and do 4 areas in a day. I have some
Really?
people, oh yeah.
Wow.
I have people who do two zones. It just
I
depends.
tell you what, this has obviously got us interested. I want to see if we can follow this into our last segment because we're coming up on a station break. So Nancy Hunter, thank you for talking to us about Cool Sculpting, and we'll add a couple minutes to it when we come back. Okay? Back after this message.
Back with the latest in health and medical news on Medical Forum, presented by At Your Service Home Care, WDXY 1240 AM and 105.9 FM.
Reliable Medical Equipment, locally owned and operated since 1999, provides a full range of medical equipment and services. Our accredited facility is fully staffed with the certified personnel for all your diabetic shoe, custom orthotic bracing, and prosthetic needs. Conveniently located at 246 Broad Street, right across from Firestone and just down from Colonial Family Practice. We accept Medicare, Medicaid, TRICARE, and most private insurance. Stop by today or give a call at 934-9212. That's 934-9212 in Sumter or 435-9927, 435-9927 at our Manning location at 37 West Rigby Street. See why Reliable Medical Equipment has been voted best facility for prosthetic and orthotic for 7 years straight. Reliable Medical Equipment.
I was visiting my elderly aunt and her phone rang.
Oh, it's you again? But I already have life insurance.
The caller was doing a great job keeping my aunt on the line.
My credit card number? Hold on.
Well, when I picked up the phone and said hello, the caller hung up.
McGruff the Crime Dog here. Recognizing fraud can be difficult for older people. The National Crime Prevention Council wants you to know how to spot a scam and report it to local law enforcement agencies.
Learn more at ncpc.org/seniors. A message from the National Crime Prevention Council and the U.S. Department of Justice.
Are you always looking for places to stop and rest because you're short of breath, wheezing, or coughing? Who wants to live like that? See your doctor for a simple breathing test to find out if it's COPD, a serious lung disease. With treatment, soon you could be living more and stopping less. Visit copd.nhlbi.nih.gov. A message from the U.S. Department of Health and Human Services.
This is Medical Forum, presented by At Your Service Home Care.
And we're back for our final segment with Medical Forum. I'm your host, Jeff Reed, with my co-host, Chris Marr. And we have our guest, Nancy Hunter Landing, who just was talking to us about cool sculpting and wealth of knowledge and too little time probably to get into it a whole lot. So let's maybe take these next brief minutes, because we want to get into all the other things that you do, Nancy Hunter. Tell us about one final statement or two or three on cool sculpting that we'd covered in the last segment that people should know.
One of the best things about cool sculpting is, first of all, what you see is what you love, because you get the results you want. That volume is gone. You feel better, you look better, and everybody wants that to be a part of their life. Cool sculpting is FDA cleared, safe, and effective. And it's the number one body contouring in procedure that we have.
And you're the one who does this in town, right?
Yes, sir.
All right. That's great.
And the alternative is leaving Sumter, or maybe not leaving Sumter, but surgery. Mm-hmm. And correct me if I'm wrong, but the downtime for surgery is significantly different than the downtime for cool sculpting.
Probably looking at a week or so, depending on what kind of surgery you're doing. And cool sculpting, you can go back to work that day.
Well, and we won't even get into all the complications that you could have with anesthesiology, too. Some people don't react well to being put to sleep and such, and that's what I think you're saying. You don't have that concern with cool sculpting. Well, great.
No.
Dr. Marr, talk us through, with Nancy Hunter, all the things that she does. And in this last segment, we've talked on cool sculpting. We've talked on, obviously, some of the skin treatments and the dangers that you help us with the sun. What else do we have on that menu of services that we want to touch on?
Well, today has been quite educational for me because I didn't quite know Nancy Hunter did as many things as she does. And the looking at the list of procedures that are done is remarkable. A lot of these procedures, and we haven't even talked about the laser treatments, a lot of these procedures can really, really change your appearance with very little work. Facial veins, patients with rosacea. Rosacea can be a bit debilitating, causing some cosmetic changes in the face, and very simply can be treated with laser treatment. Mm-hmm. Nancy Hunter, tell me about that.
Facial veins are sometimes seem to be somewhat of a nuisance to people because, quite frankly, people feel like if you have facial veins or you're red through the cheeks that you may have partaken some other beverages sometimes. So I've had a lot of people come in and say, I'm tired of people thinking I have too much wine or too much alcohol. So by being able to treat those facial veins, it's very simple. You come in. It usually takes 1 to 2 treatments, depending on how many you have. And most of the time, they're gone within a day or two.
Wow.
The vein is gone.
Are we talking about a vein, or are we talking about a red? The face is red, or the face has like...
Well, there's two components to rosacea. Let's just talk about rosacea as an example. The one component is the redness that occurs on the cheeks and sometimes across the nose. That may resemble like an irritated acne. Mm-hmm. And then underlying are what we call spider veins that can occur in these areas. Mm-hmm. And oftentimes the redness can be easily treated with topical lotions or creams, but those creams are not going to manage the spider veins.
And all the laser is doing is coagulating the blood, which is burning it. And once that blood is burned, it just seeps back into the body and goes away.
And so
It's
what
simple.
you're doing is closing off the entry point of those little veins. And once you close off the entry point, then the vein completely just disappears.
What other lasers do you use the laser for? What other procedure? What else would somebody come see you?
Dr. Marr, he mentioned that sometimes people may have issues with their skin coming in to see us. And one of the biggest things that I have seen over the last 10 years of being in business is women with facial hair.
Mm-hmm.
And every single one of us has it. And when you come in and you think that there isn't anything you can do, and we sit there and we talk to them and we explain the procedure, we tell them what is going to happen, and within 6 months of them starting their procedure, most women are hair-free, and it completely changes their whole demeanor, their confidence. Is
that a long-term solution, or just maintenance and the follow-up of a treatment?
It is long-term, and you do have to maintain it. Facial hair, what I've learned is if you do not destroy that hair follicle or that root at some interval, it's going to heal and it's going to start to produce hair again. So there is a maintenance to it, but you get to the point where you're not worried about, is the person looking at you and talking to you, or are they seeing that hair on my face?
But the alternative, Jeff, are for facial hair or body hair that's unwanted are pills that have side effects, creams that require daily use any rate and are very expensive. Electrolysis. Tell me about electrolysis, just real quick. Electrolysis is not a.
It just sounds painful.
Not a well
is this
procedure.
Right?
Electrolysis back in the day was wonderful, but it takes forever. And when you're trying to do a lip or a chin, you are having to hit each and every single hair follicle. And it is a needle being injected and then a heat at the tip of that needle. It is not fun. It takes forever. You cannot treat the entire face in one session.
Yeah.
Laser hair removal, we treat the entire area in one treatment, and all of that hair is going to fall out.
Let me ask you something. Laser. That somebody going, oh my gosh, it's just going to hurt.
You feel it.
You feel it? But we feel like men that shave. We feel an electric shaver on us. Are we kind of in that ball game as far as feeling?
I tell every single one of my clients when they come in that laser hair removal is uncomfortable, but for 5 to 10 minutes of discomfort, for 5 to 6 weeks of no hair, I'll take it all day long.
Gotcha. Let's finish up here. As we have about 25 seconds. We want to thank you for coming in on this Saturday.
Thank you for having me.
I want to remind all the audience out there that we also will re-air this show. So if you miss anything or catching it late and want to recap, it's on this Sunday from 2 to 3. And as we finish the show, give us one more time. Contact point. How can we reach you, Nancy Hunter?
We are Colonial Aesthetics. We're located at 385 West Westmark Boulevard, and our number is 803-774-2400, and you can also find us at the website, www.colonialaesthetics.com, and Facebook.
Well, everyone out there, I think after hearing this, you'd be crazy not to go and see her. So thank you very much, and Dr. Moore, see you next week.
Have a good week.